Now, this is not used as commonly in cognitive disorders. There's not an FDA-approved deep brain stimulation treatment for things like Alzheimer's and certain dementias. But Parkinson's disease has had deep brain stimulation approved since 1997 for its motor symptoms. Okay. And what that is, for those of you who are not familiar with deep brain stimulation, it's actually the process of putting a very tiny electrode that can emit electricity and stimulation into the very inner part of the brain called the basal ganglia, which I mentioned earlier, which is abnormal in Parkinson's disease. And then that electrode comes out. It's not outside of the body or anything. It is all internalized. But just so you can see it here, it's like they've opened it up for you. So that electrode comes out, stays underneath the scalp, but is connected to a wire or a lead extension that goes down to a battery inside your chest. And how we often use deep brain stimulation is to help with motor symptoms. When the levodopa, which is the dopamine replacement we use, may not necessarily be as helping the patient as much as their disease progresses, we turn to deep brain stimulation, which can often help tremor, slowness, and stiffness, and really improve motor symptoms. But now what we've learned, right, is that we have these markers that we can actually follow in the brain. So not only are we providing stimulation, but we can actually sense your actual brain waves with these electrodes. And what they're working towards now are deep brain stimulation devices that actually program themselves. So they detect when you have tremor from these abnormal brain waves, and they can adjust the stimulation accordingly. Okay. That is what they're working towards. So they don't do that yet. Some of you guys who may be familiar with deep brain stimulation may know that right now the doctors are like, you would see me in clinic and I would give you a specific setting. And I kind of judge based on your symptom control where your setting should be. But because we have learned so much about these EEG biomarkers, we are improving these devices so that they'll get better and better and maybe not need as much of the human presence, like me guiding programming, which is interesting to think about, maybe even a little scary to think about. But it's really neat that they are able to use these EEG biomarkers to improve the treatment of Parkinson's patients.